You're listening to the Fitness Business Podcast. This is a special interview on a very important subject, physical activity levels across the globe. Today's episode is brought to you by our founding partner, Active Management. The Managing Director, Justin Tamsett, says that his mission is to reduce healthcare costs across the globe by having more people move and move more often. No matter where in the world you live, you can work one-on-one with JT and he can help you get your community moving and moving more. Go to www.activemgmt.com.au/FBP family for an exclusive opportunity to work with JT from Active Management. Hi everyone, welcome and thank you for joining me for this special edition of the show. There is a significant initiative that is being introduced across the globe that will have a big impact on the fitness industry and on the health and activity level of adults. The Global Action Plan on Physical Activity 2018 through to 2030 has recently been released, and last week I had the opportunity to interview Dr. Fiona Bull from the World Health Organization. During this interview, Dr. Fiona shares the two main goals of the plan, an overview of the 4 key pillars. We discuss the countries taking part, and most importantly, and this is where you all come in, we discuss how fitness businesses and professionals can get involved. We're releasing this show in late February 2019, and just days after this goes live, key leaders from the global fitness industry will be meeting in Geneva, Switzerland to take part in the global dialogue to discuss the plan and ways that the fitness industry can come together to impact the health of the global population. This special report will give you a first-hand overview of what the plan involves, and in the month ahead, we will be inviting key representatives from industry bodies including IHRSA and Fitness Australia to join us on the show to discuss what actions they'll implement to support the plan. I really encourage you to take a close listen to what Dr. Fiona has to say today. And if you would like further information, I'll be adding a link to the action plan in today's show notes at fitnessbusinesspodcast.com. It's now my pleasure to introduce Dr. Fiona Bull. Fiona, welcome. Thank you for joining us on the show today.
Well, thank you very much for having me.
Just to set the scene for everyone so we know where we're at currently, from a worldwide perspective, can you describe the current physical activity level of adults?
Yes, well, worldwide, the average is 28% of the population are not active, which of course means everyone else is doing some activity and some people are doing a lot more. Now that 1 in 4 not being active is the focus of our concerns, because we know the health benefits and we want everyone to get those benefits of physical activity and being active. But behind 1 in 4, it actually hides a lot of variation, and it can be up to half or over half the population in quite a number of countries. That means half the adult population is not being active. And when I say being active, we're talking the WHO global guidelines, which is 150 minutes a day, a week, or approximately 30 minutes 5 times a week. That's not a lot, and we know there's great benefits from that. So we've got a big global health problem.
Absolutely. Now, off the back of the research that you've done, the World Health Organization have created the Global Action Plan on Physical Activity for 2018 through to 2030. So tell us a little bit about the catalyst to creating that plan, and then I'll get you to share an actual overview of the plan with us.
Well, the background to the plan is, I think, the large scientific evidence that's been accumulating now for 30 or 40 years or longer. Some of the very early research was done in the UK in the 1950s. And since then, more and more science from around the world has continued to confirm the strong health benefits in preventing and protecting against cardiovascular disease. So that's heart attack and stroke. They're the leading cause of death worldwide. Also against different cancers, particularly known to protect against breast cancer colon cancer, and then diabetes. And I'm sure the listeners are recognizing these as some of the very common health conditions that people are getting. And we know they're causing premature death. That's death before the age of 60. So people really quite young and should be healthy, active and enjoying life. But these diseases are occurring. And I think the recognition that the science was very strong, but a frustration about the lack of action. And so whilst we had a global action plan in 2004, there was not a big response to it. And so still levels of physical activity I've just described remain a concern. And so the member states, that's the countries that are members of the United Nations, asked the World Health Organization to review and revise and develop a new global action plan. They asked us in January 2017, and we delivered that 12 or 14 months later in May 2018 at the World Health Assembly, and it was fully endorsed.
Fiona, so can you now take us through an overview of that plan that you presented?
Yeah, well, the plan sets out two goals, and that's to increase participation levels by 10% by 2025 and by 15% by 2030. And those two dates are important. We have a set of global goals for 2025 across a range of health areas. And of course, 2030 links with the Sustainable Development Goals. I'm sure your listeners are aware of this global agenda to improve the health of people and, of course, the environment and the planet. The Global Action Plan on Physical Activity is built of four areas, four pillars, if you like. And I'll briefly go through each one and happy to go into any further detail. The first pillar is promoting the benefits of physical activity, the health benefits, social benefits, and even environmental benefits. If we think about walking and cycling, we can do that to get to places and use the car less. But we have to promote the benefits so people are aware of it. More so in some of the countries where this is less familiar. People tend to think that physical activity is something you have to do, not that you want to do and you choose to do. And we want to make a real paradigm shift, encouraging everyone at all ages to see it as something we all do. It's good for health and good for the environment. That's number one. And I can tell you how we'll do that. There'll be a lot of campaigns, a lot of promotion by everyone. And I hope your audience is thinking about how they can join to promote those benefits. Number two is the environment and the places and the spaces that we're active. We need to improve that so it's safe, affordable and accessible. There's quite a lot of differences between people's access to places, the affordability of gyms, clubs, ways of being active, even equipment. And so some people are not active because they can't afford, can't access, or it's not safe. So we need to make those improvements. But that's not enough, because just living in a nice place like Switzerland doesn't automatically mean everyone is active. The environment is important, but we do need to promote and provide opportunities, whether that's in recreation facilities, sports clubs, schools, the workplace, and around our community in parks and open places. So how we promote and how we provide opportunities that are fun and enjoyable will be really important. And then the fourth pillar, the last one, is about making sure we have connections between everything we're doing. We all, in a community, have good data, an evaluation, a plan. We're all working together, research to help inform and improve what we do. And of course, we're funding this initiative through the government support and everyone else's support, which can be in kind or other contributions. So 4 pillars: promote it, provide environments, provide opportunities, and then the last is the systems and governance to make sure we're doing the best we can with the resources we have. That's the Global Action Plan. It's applicable to all countries, and countries are at a different point of starting this agenda. The US, the UK, Australia, and some of your audience will be in countries where there's been a long history, even if the data still show there's a long way to go. But many of the countries, this area is quite new. And we're particularly interested in promoting physical activity in some of the emerging markets, some of those countries going through rapid transitions like India, China, Asia, and Africa, because the changes are changing how active people are. And so promoting physical activity, this global action plan, relevant to all.
Fiona, first of all, thank you so much for explaining that to us and talking us through those 4 pillars of the plan. In what you've seen so far, can you share with us any examples of different organisations, whether they be in the fitness industry, whether they be in health and medical, of how some of these pillars have started to roll out so that we can start to understand how we might be able to get involved?
Yeah, well, thank you. I think you're absolutely right. This is a big opportunity for many sectors, including the sports, recreation, fitness and exercise. They're going to be core to helping us deliver, helping countries achieve this. And, there's a win-win here in terms of the benefits of a more active communities for everyone. Some of the examples, I think we're seeing how people are changing the ways they want to be active. And so responding to that, taking the opportunities closer to where people are. So you're seeing some organisations generously set up things in local parks, and that may be health insurance companies who are providing trainers in local parks who are running things for free, and that's bringing people who are a little less active and maybe a little concerned about exactly what's on offer in gyms and clubs they haven't been to for a long time. They find them a bit intimidating. So taking the enjoyment and the opportunities out to where the people are is going to be key to engaging the people who are not currently members and are not active. Some of the other examples, of course, are promoting physical activity to the people who are less active. And in those data I mentioned earlier on in the interview, I didn't mention the big differences by age and by gender. And nearly in all countries, women are more inactive. So women are less active, and we've got to think about why that might be and how to attract more women and more girls back to being physically active regularly. And so clubs, recreation centres may think about what really do women and girls enjoy. And there are differences: social, fun, music, less structured, less competitive. I think we've known these things, but are we responding with enough options that are affordable and accessible to more women? Other big difference is in age, and maybe no surprise, but as we age, we get less active. Now, that from a health issue is real concern, because it's at the older ages where we may need to be more active, certainly to maintain strength, flexibility and balance so we don't fall. Hips and knee injuries are major concerns for those of older age. And of course, staying at home and being independent is so important to older adults. But we need to make sure people who are just beginning to think they can do less, quite the reverse. It's time to do more in ways that are appropriate, enjoyable and safe. So those areas of women, girls, older adults, and many of the emerging markets are real opportunities for the industry.
Fiona, you mentioned that when you initially presented the plan that you had full support from everyone in the UN. And so just for our understanding, are we likely to see in different countries that are involved across the world, are we likely to see our individual governments get on board and start to put out material, educational material and promotional material with the Global Action Plan on Physical Activity branding? Like, what are we likely to see come out from each of the countries?
Well, that's exactly what we're hoping to happen. And so countries are beginning to respond. Obviously, there's a cycle of planning and government processes that most countries are beginning to go through as they have seen now the plan and endorsed it last year in May. They are looking at how they will respond. So governments, the ministries of health, are looking at developing their own national action plans, which is the recommendation. Each country looking at what are we doing, what are we not doing, and how do we start to take on board and implement these recommendations. A very key part of that will be it's not the Ministry of Health on their own. They're the agency for which WHO responds and supports, but of course ministries of sport, ministries of education, in fact nearly all government departments have got something related to do this with this area. And outside of government, the solutions as the Global Action Plan outlines, and I invite your listeners to go to the WHO website and look at Let's Be Active. That's our campaign. That's the website. If you Google it, you'll find it pretty easily. And you'll see on the Let's Be Active and in the Global Action Plan a whole of system everyone having something to contribute to making this world more active. And so governments are going to respond with developing their campaigns, but hopefully engaging all those other partners like the private sector, like the sports and rec industry, who might also respond with suggestions and ideas and campaigns themselves. And WHO is very keen to talk with all stakeholders about how to work together to have good communications and campaigns in lots of countries. So I invite your listeners again to come to the WHO website, where we're very interested in hearing from the sports sector what their suggestions are for governments and for WHO and for their own sector to respond.
I think this sounds like a tremendous opportunity for everyone to get involved. And are there any other last pieces of advice that you would leave with us, or encouragement that you would leave with the international fitness industry to get involved in the Global Action Plan on Physical Activity?
Well, I invite everyone to think about how in their work they can achieve the win-win, which is increasing club membership, participants in your programs, your services and your initiatives, by engaging perhaps those who are outside, a little on the periphery. You might know about them, but think about who I've just said are least active. Older adults, girls, those living in less advantaged communities. How can you expand your work, expand the reach of what you do, offer your services in ways that can help us to get more people active every day and as part of a regular lifestyle? Because that will lead to a growing momentum of seeing more people being active, recognizing it's something that we all do, not just the young, not just the already fit. And there's a lot of people who really aspire to being active, but what we've been doing over the last few years is not reaching out to them and giving them the confidence and the enjoyment to participate. So a big challenge for the industry, how to innovate around the wider community and engage them.
I think it's a great challenge for the industry. So, Fiona, I want to thank you so much for taking the time to come on the show and to talk to us about the Global Action Plan on Physical Activity, so that we all have a much better understanding of the incredible job that the World Health Organization have done to actually assemble this plan, to create this plan for 2018 through to 2020. So thank you so much to you and to all of the team for the work that you've done. And I hope that as an industry, we can also really help support this initiative and take your encouragement today to go and take a look at the website, go and take a look at the plan and have a think about how we can actually affect and support everything that you're doing. So thank you so much for joining us on the show today.
Well, thank you for the opportunity and look forward to hearing and seeing what the industry can respond.
As a listener of the show, you have a special opportunity to work with JT from Active Management. You can buy one coaching session and get one free. No matter where in the world you live, technology allows him to work with you. Go to www.activemgmt.com.au/FBP family and work with JT to get more people moving and moving more often. That offer is buy one coaching session and get one free, and it's exclusive to you. Go to www.activemgmt.com.au/FBP family. Thank you once again to Dr. Fiona Bull. For those of you who would like more information about the Global Action Plan, I've put a link in today's show notes at fitnessbusinesspodcast.com. As we finish off today's show, it seems like there is no better time to remind you that what you leave behind is not what's engraved in stone monuments, but what is woven into the lives of others. Thank you for joining me today.